Good morning, everyone. And we're glad that you're joining us today for this webinar discussing the findings of two recent research projects relevant to the inclusion of women in the workforce. The time allocated for this webinar is an hour, and we will try to maintain the time within these within the agenda that we have for us and for the Q&A. I will start with some housekeeping rules. So I would ask everyone to keep their microphones and cameras off during the presentations. Only the presenters will have their videos on. Questions and answers to the presenters could be asked at any point in time. And unlike what the slide says, kindly use the chat function to post your questions and answers rather than the Q&A button. So again, the questions to the presenters could be posted using the chat function. The chat function will also be used to share additional technical information and for sharing resources and materials. And we would like to let you all know that the session will be uploaded on the Information and Research Center of King Hussein Foundation YouTube channel. The link is available here, and it will also be posted on the chat function for you to look at later. Next slide, Jude. So I will start with a quick introduction to the research and the context of women inclusion in the labor market. So in this webinar, the Information and Research Center of King Hussein Foundation will present the findings of two interesting research projects. The first on social security reforms and women's employment in the private sector. And it looks at the reforms that started in 2010 to the social security law that benefited mostly private sector workers. It uses a mixed method approach, and it aims to generate in-depth understanding of the impact of the reforms and COVID-19 on women's employment in the private sector. The second research project looks at the double burden on women in Jordan, especially in light of COVID-19, and it was conducted at an interesting time frame, which is May 2020, and it explores the way in which unpaid work was distributed among the respondents, mainly women and men, and how they balanced that with paid work. The two research projects were conducted by the Information and Research Center of King Hussein Foundation, and they are part of the Women Empowered for Leadership program implemented by Hivos and funded by the Dutch Ministry of Foreign Affairs. I will start by giving you a quick overview of a lot of things that we all know, but it is important that we go through these quickly so that both research projects and their findings are interpreted within this context. First, it is important to remind everyone of what we already know, that the labor force participation of women is extremely low in Jordan. But in Jordan in general, the labor force participation amongst both men and women tends to be lower than global averages. In 2019, about 40% of the population were economically active, and that means they are either employed or actively seeking employment. But if we look at the labor force participation of women, and we know that the extremely low number, it is 13%, 14%, depending on the specific definition or the year that you're using. But in 2019, only 13% of women were either employed or actively participating in the labor market. And those who are in the labor market were facing an employment rate of 24%. So out of 10 women participating in the labor market, a quarter of them were basically unemployed. And this rate seems to be consistent with the number that we see in 2010. Unfortunately, we saw a spike in 2016, but in 2019, and the numbers of 2020 are not encouraging either. Next slide. Now, labor force participation of women varies by marital status and by educational level, and that's a finding that has been iterated over and over again. And so on the diagram, we see data from the employment and unemployment survey, and women that never married participate in the labor market at a rate of 19.4% compared to 10% to women who were married or ever married. The job diagnostic used a regression analysis, or then released squares, and found out that married women are 12.5% less likely to participate in the labor market, and they are 9.6% less likely to be employed. But also looking at the educational level, the same report found out that women with post-secondary education are 37% more likely to be in the labor force. So education and marital status sort of explain labor force participation rate for Jordanian women. But given the two sort of slides that we looked at before, how does that translate on the number of women actually working in Jordan? And this diagram basically tells us the story. So a working age population, as expected, is split equally between men and women. But when looking at those who are employed, we find out that only 1 of 10 Jordanian women is employed, compared to a much larger share among Jordanian men. So although everybody claims, and it's a very valid claim, that the economy did not create enough jobs for both men and women, it is evident that women have a lower chance of being employed in the labor market. And this weak participation of women in the economy have been analyzed over and over again, and everybody is saying that it is due to well-identified obstacles. So one of the reports on women's access to economic opportunities identified some of these obstacles, such as social norms, legal frameworks, and the Information Research Center of King Hussein Foundation conducted a very interesting research on that, the care economy and the care burden. There's few reports in the pipeline on that, and one of our research projects that will be presented today will look also into that. The gap in entrepreneurship, technology and finance, transport in terms of adequacy and quality, and also agriculture is included here as one of the sectors or the private sector employers where decent working conditions and family-friendly policies are lacking. And these different obstacles interact throughout the women life cycle. And apparently, it has been observed that there are critical turning points in women's participation in the labor market. First, during the time when they are getting ready to participate, then in entering and remaining the labor market, and the transition from work to, from education to work, then getting married and the care responsibilities associated with that. And the final step is having a child. Next slide. Social norms have been, and I want to focus here on this slide that talks about social norms because it also touches on multiple other issues that have been identified as obstacles. And there's a very good research that took place in 2019 on social norms in Jordan, and it conducted a measurement of the different elements or the binding constraints that affects women's participation in the labor market. And the main findings of this research was the following. First of all, that 2/3 of non-working women would like to work, and their own preferences and personal beliefs are not a major obstacle to participation. So that's a very critical finding. There are many people who would say, well, Jordanian women do not want to work, and this report basically in the research conducted there indicates that women actually would like to work. But women's labor force participation is limited by binding constraints and intra-household expectations, such as expectations of husbands and fathers. And the binding constraints include lack of supporting services, such as childcare, adequate public transportation, scarcity of attractive job opportunities in the public sector and in the private sector. They've also mentioned the discrimination in hiring and wage and limited growth. But women's actions, from a social norms perspective, women's actions in relation to participation in the labor market are more aligned with men's preferences. And the ultimate decision makers when it comes to jobs are the fathers and the husbands. And if we look at the diagram and we focus on the orange line or yellow line, depending on how you identify the number on the diagram, we find out that 96% of the population believes that it is okay for Jordanian women to work. But that share of the population and the beliefs indicate less agreement with that statement if the work is outside the home, so it goes down to 80%. And then if the woman is married, it goes down to 72%. If she leaves a child with a relative, that goes down to 54%. If she works in a mixed environment, i.e. with a man, then the share goes to 38%. And finally, if she returns after 5 p.m., then the share goes to 26%. And all of these are social norms that are forming the decisions of women to participate in the labor market. And that's very, very important because of what the next slide is going to tell us. So through the past few years, the number of women and men working in the private sector is increasing, and employment in the private sector is, by definition, is more likely to involve working to later hours and working in a mixed sex environment and leaving a child with a relative or in a care center. So if we look at the 2019 data, for example, we find out that 70% of the people who are employed in Jordan are employed by the private sector. If we're looking at Jordanians only, that makes up 50% of the workers. And if we look at the slide that follows, which is a different perspective to that employment in the private sector, we have two diagrams here, and I would like to give a bit of explanation. So these diagrams include the number of insured persons between 2011 and 2019, using the Social Security Corporation annual reports. And one diagram is those who are employed in the private sector, and the other diagram is those that are employed in the public sector. And as you can see, that the number of workers insured who are working in the private sector are much more than those who are working in the public sector. So the workers that are insured in the private sector are increasing. And for the past few years, if we look between 2017 and 2019, women made up 30% of those insured individuals. So the slides that I've just went through tell us a few things. First of all, women's labor force participation is low. We know why it is low. Care responsibilities, perceptions, and working conditions in the private sector apparently affect women's labor force participation. And the labor force information is telling us it is likely that more women and more men will be employed in the private sector in the future. Thus, the two research projects that will be presented today will give us interesting information on how COVID and the reforms of the Social Security is affecting and helping us do more to support women participation in the labor force. So I would conclude by this slide, and we'll move on to the next presentation on the double burden of on women in Jordan, and Dr. Aida will be presenting this section. Over to you, Aida.
Thank you, Shireen, and thank you for everyone joining us today. I mean, I think it's quite rare that, you know, when we look at women in the workforce in Jordan, we tend to always focus on, you know, the public sector, the private sector, the informal sector. But we had the opportunity at the Information Research Center this year to have a look at the other side of the coin. So rather than just the sectors, the public and the private spheres. I mean, we know in Jordan we live in a patriarchal society in which women are quite underrepresented, whether in the public sphere, especially when it comes, politically or economically. Um, we are always trying to increase women's participation. And when the pandemic started and we entered this, nationwide lockdown in Jordan, we and our partners at Hivos recognized the opportunity to capture what, is often referred to as gender dynamics, gender roles, the work-life balance that women are always, um, facing in the private sphere. And I mean, not just in Jordan, this is really a global issue. I mean, we know that it's internationally recognized that marriage, children, household responsibilities often limit women's economic participation. And the lockdown was a very rare opportunity for us as researchers to see what happens in terms of gender roles within the home when both men and women are in the same situation when it comes to employment, childcare, household responsibilities, working remotely. So we wanted to see if the gender roles changed. So we focused on this issue of the double burden, and what do we mean by that? So unpaid work within the home, which is often referred to as reproductive work, includes a variety of tasks. We mentioned childbearing and caring, preparation of meals, cleaning, maintaining, household responsibilities. It oftentimes includes taking care of elderly members of the family, members of the family that may have a disability, or among others. While paid work is tied to a monetary value, unpaid work is oftentimes not recognized as real work, even though right now there is a movement towards quantifying unpaid work to understand, to be able to compare its value to that of paid work. So unfortunately, in most patriarchal societies, women's participation in productive or monetary recognized work is lower than men's and is generally undervalued and less visible. And due to women's higher engagement in unpaid work. Men, are usually have more, the time to invest in their paid work to move up into leadership positions and so on, whereas women struggle in the workplace also based on what they are dealing with, based on the responsibilities at home. And in times of disaster, so this was actually what we found to be even more relevant to the 2020, not just the lockdown, but overall the situation with the pandemic, is that whether it's a disease outbreak or war, most women take up greater responsibilities and are often overburdened with paid and unpaid work, which impacts their overall well-being, and new roles are given to them during such events, and they usually come without the alleviation of their existing responsibilities. And the gender division of labor, which is already inequitable, heightens women's vulnerability, and the additional responsibilities can have long-lasting, well beyond the resolution of the pandemic. And that's what this cycle over here shows, that during such situations, the new responsibilities that they take on and how it overall, just as we know, other gender issues are exacerbated. I mean, there's been an important focus on, for example, gender-based violence this year, and but I mean, similarly, other issues such as the double burden that women face is also exacerbated. Next slide, please. Thank you. So just quickly in regards to the methodology and sample, the timing, I think, was crucial. That we managed to do this. I mean, it's one of the strengths of the study. It wasn't conducted, several months after the lockdown finished, asking people to reflect on what, based on memory, but it was actually something that, that they were living in at the time. So we collected the data within a week between the 21st and 28th of May. And it was just before, the lockdown was completely over. And it had quite a sizable sample, 555 men and women in Jordan. Of course, there are some limitations. One of them being that it's not a representative sample because this was conducted online. One, we were in a lockdown, and it was the best way to reach out to people. Um, Nevertheless, it was a sizable sample. 79% of respondents were women, 21% were men. We do have to keep in mind that there are, in terms of the limitations, there were barriers such as those who have access to internet. And those who actually volunteer to take the time, the 10 to 15 minutes to complete the survey. But still, with 3,555 respondents, we feel that it's a significant enough size of a sample to be able to draw out some important conclusions. So looking at employment status during the lockdown, of those who were employed before the lockdown, as you can see over here, 26.7% of women were working from home for 2 to 5 hours, and 25.4% were working 6 to 10 hours, in comparison to 11.1% and 10.4% of men, respectively, who were working also during the lockdown. Of those who responded, more men were on unpaid leave, of those who respond, more men were on unpaid leave, which is 13.2% over here, and working from the office, 18.2%, or became unemployed, 28.2%. So that just gives you an overall perspective of what the employment status was for both men and women. Now, when it comes to who is the main breadwinner, this was calculated for the entire sample, both men and women, and you can see that for the majority, it was shared between the spouses, so 63.3%. And emphasizing here that it's no longer, what we traditionally think of, that, men have the responsibility of bringing in the income, whereas women are, restricted to the home privacy. Clearly, the situation has changed. And so this is where we have to keep in mind that the work that is being done at home, the unpaid work at home, how it all adds to the double burden of women. So we asked, if they had experienced any of the following during the lockdown: partial loss of income, total loss of income, loss of a job, loss of home, loss of savings, or none of the above. And while some, both men and women, did say none of the above, the majority did say partial loss of income. Keeping in mind that this does not add up to 100, because we did ask them to check all that apply, because also during different stages of the lockdown, every month, almost every 2 weeks, the situation differed. So partial loss of income was definitely the most common for both men and women, as was loss of employment and loss of their savings. Some did lose their homes, and as I said before, some weren't affected at all. So in regards to the responsibilities that they had to carry out in terms of household responsibilities. So we asked them, in order to be able to compare how the lockdown affected them, what was their situation in regards to their responsibilities before the lockdown as well as during. So you'll see, again, check all that apply, so it doesn't add up to 100. But what you can see is that when asked about the frequency, it was never or rarely, some of the time, most of the time, and the figures show that the percentage of women and men who carried out these responsibilities both increased during the lockdown. The charts show that the responsibility of unpaid work disproportionately falls on women, especially when it comes to, as you can see here, childcare, as well as cooking, cleaning, dishes, and laundry. So as a result of the lockdown, respondents were asked whether they felt their responsibilities at home increased, or if they felt that they were being shared equally with their spouses. And looking specifically here at employed male and females, you can see that the majority, said that the responsibilities increased. Women more so than men, but still both said that they increased. And the percentage of respondents who felt the responsibilities were shared equally, the majority of employed males felt this way, whereas the majority of employed females wanted their spouses to do more. Now, if we can move on to the next slide. So of those who wanted, so keeping in mind that 25% wanted their spouses to do more, when we asked simply everyone, did you communicate this to your husband? We asked women to answer. The majority said yes, but still the comments, as you can see here, show that even if they did communicate this, it doesn't mean that they got the end result that they were looking for. And when it comes to those who didn't communicate it at all, you can see that, they say that they're so ingrained in these gender roles that they find that, there's no point. He won't accept it. He has other responsibilities. He doesn't know how, for example, the children, or he just won't accept taking on more responsibilities. So in order to avoid problems, to avoid arguments, and here again, for example, this quote showing how, gender roles are so ingrained and a part of our social norms, because he wasn't raised to help. He was raised to be served. He wanted to raise our children the same way, but I insisted that they should learn how to help regardless of their gender. And so in these charts, we looked at, of course, mental health was an issue for everyone across the board. But we looked at, here to see how mental health may have affected men and women differently. And more women than men felt agitated by things that normally didn't bother them. They felt that everything needed extra effort, and they even felt lonely during this period. And you can see here just a couple of examples from the quotes, that the responsibilities increased, that the roles, a teacher, a cook, a caretaker, of several children, but as well as here in regards to the work, the required work is more than the available time. And here also a quote from a man in Zara'a: I didn't have cash to spend on my family, and they refused to give me money from the Daily Workers Fund because I own a new car, which is my only source of income. So again, the concern that they had. Okay. So sources of worry or anxiety during the lockdown. I think it's evident that the main source of worry for everyone was loss of income, and which is also tied to fear of the future or the unknown. Keeping in mind again that here both men and women checked everything that applied, so they didn't have to select between them. Loss of income and fear of the unknown being the top two reasons. As well as for women, restricted mobility and the increased responsibilities at home. So it shows you again the emphasis or the weight of this double burden on how women are feeling, keeping in mind that of course they do have a lot of the same concerns that other men did. So yes, and just again, a couple of examples of the quotes if you had a chance. You know, a working mother didn't get to enjoy the lockdown the way other women did, trying to juggle, you know, this balance. Men, you know, when it comes to loss of income, I lost my job because of the lockdown and I no longer have an income to feed my family, feeding into their sources of worry or anxiety. To cope, the next slide. For both men and women, the main mechanism or for coping with all of this was talking to family members. In some cases talking to friends, but for the most part, the majority, both male and female respondents said to other family members, and less so physical exercise or hobbies. So clearly, those family relationships are important. So just to reflect on all of this data, why are gender roles divided this way? Our center has been researching, gender roles, gender equality and equity, doing research and advocating for this for several years now. Some of you may be aware of a study we worked on last year focusing on the causes of gender discrimination in Jordan, looking at patriarchy and so on, which we had done in partnership with UN Women. So we know that in Jordan, the society is patriarchal, and as I said before, women are underrepresented, especially economically, as we're speaking of today, but even politically. And we need to recognize that for a woman to enter, let alone to stay and if possibly move up in her job, the workforce, there are many aspects that need to change. Patriarchy and gender roles are embedded in, as you can see here, our education curricula, the media, religious teachings, and more so, the whole framework for everything, which is the legislation. Because while the Constitution is based on principles of equality, various national laws discriminate between men and women. But just as important to all of this is the social norms, the gender norms that that we socially have constructed, men and women alike. We are all a part of this construct, and this is where, as much as we focus on, and we have to continue actually focusing on all of the ways that we can support women to enter and stay in the workforce, in their places of employment. Whether formal or informal sectors, public or private, or entrepreneurs and so on. We need to also look at the other side. And funnily enough, that when we were conducting this research, we were actually criticized online by some of those who didn't see this relationship. Why are you asking such stereotypical questions about how men and women are spending their time in the household? And I think that that's a real problem, that if we don't see the connection between what's happening in the private sphere, how can we expect women to truly be able to get to invest their time and everything in the public sphere? And we know that women suffer from this lack of balance under normal circumstances, whether you call it the double burden, the work-life balance. But when all the variables became the same during this period of the lockdown, which was, again, a very unique opportunity, you know, did the gender roles change? You know, did men and women have the opportunity to share the responsibilities that they wouldn't usually have? And unfortunately, as you can see, no, because this is again ingrained in our society and the way that we have constructed our roles to be. So I'm gonna end there and let yeah, if there are any other points, to take it up in the discussion. Thank you.
Thank you, Dr. Aida, and thank you, Shireen. So I'm going to just give you a quick overview of some of the findings from our research on Social Security reforms and COVID-19. So just to give you a bit of a background, in 2010, a new Social Security law was introduced, and mainly to enhance social justice and gender equality. Between 2011 and 2014, our center, with support from the World Bank, contributed to a study that was designed to kind of understand the level of knowledge and awareness of the new law amongst Jordanian men, women, and employers. And specifically to kind of understand how they see the law, if the law is going to increase women's employment. So now that several years have passed in 2020, this research uses a mixed method approach to kind of generate an in-depth understanding of the impact, so the actual impact of the Social Security law reforms, as well as the pandemic on women's employment. So when we started designing the research, it was purely to look at the Social Security reforms, but then it was kind of the inevitable COVID-19 and the pandemic hit Jordan and had a huge impact on not only the private sector, but also all the employees in the private sector. And so it was important to kind of factor in the impact of the pandemic into the research questions. So just a quick overview of the methodology. To answer our research questions, we did a thorough review of legislation and literature. We also did 20 in-depth interviews with employers to kind of understand their experiences and perceptions. We also did 457 surveys with employed and unemployed women in Amman and Irbid, because these are based on DOS statistics. These are the two governorates with the highest number of women employed in the private sector. Before the pandemic hit, this was meant to be purely a qualitative research, but because given the social distancing and gathering restrictions, we converted focus group discussions to surveys instead, and we did them over the phone. Employers were selected from different firm sizes, so small, medium, and large, and different sectors, including wholesale and retail, manufacturing, hospitality, finance, and so on. Every research has its limitations. If the circumstances were different, if we did have more time, more resources, and more freedom, we would have conducted the surveys in person, and we would have conducted more interviews with employers to kind of get even more in-depth understanding of their experiences. It was very important to first ask employers about their hiring practices, because we know that there are two sides of every story. So if we're looking at access, women's access, so it's their willingness to participate, but also employers' willingness to hire women. And employers were asked to cite the top 3 characteristics that they look for in a candidate who is applying for a job. While most said that they look, for technical skills, personality, soft skills, and so on, 7 out of 20 actually stated their preference to hire men or unmarried women. So they said that very clearly. Some explaining that the type of work and their industry and the nature of the job requires that, and others mentioning that actually marriage and childcare responsibilities which fall on women require them to kind of take more leaves and as a result become less productive at work. So this is kind of like a main barrier. Also related to hiring practices, we found that most, and we're not generalizing, but from the sample that from the participants that we interviewed, most medium and large firms were found to have more formal hiring policies and procedures, while smaller firms hired on an informal basis and based on preference. And so the more informal the hiring practice is, it doesn't only increase the risk of discrimination in hiring, but it also increases the risk of patriarchal practices, which, you know, Dr. Aida just referred to in her previous slides. So for example, you know, this was one interesting example. One employer from a small firm said that when a female candidate applies, he makes it a point to call her father to make sure that, you know, he knows about her whereabouts, he knows and he's okay with her working in the shop. And that's like one layer of patriarchal practice, but we need to understand why this is happening. Based on this employer's experience and other shops, other surrounding shops, one of, you know, his neighbors had a father and brothers come in and completely destroy the shop and become violent with the employer because they did not know that their daughter and their sister was working in that shop. So that shows the multiple layers of kind of patriarchal practices and perceptions that are inherent in the society, and as a result then hinder women's access and participation. It was important, so we asked women in a job interview, were you ever asked about you know, if you were married and your plans to have children, so whether in a job interview or a job application. And around 75% of women actually said that they were asked about whether they were married, about their marital status, and 25.7% said they were asked if they were planning to have children. And around 40% of those women felt that their answer actually affected their chances at getting the job. So directly related to childcare responsibilities and marital, you know, marriage and childcare responsibilities is the maternity leave. We asked employers, what are the main challenges that they face when a female employee wants to go on maternity leave or takes her maternity leave? 5 employers, 4 from small firms and 1 from a large, stated that they do not face any challenges because they don't hire women or they do not hire married female employees. And one of them stated that this is actually the reason why he does not hire women, because he does not want to have to deal with something like maternity leave. As for the rest of them, the biggest challenge was kind of ensuring that the workflow remains uninterrupted. So one employee leaves, most of them said that, you know, regardless of sector or size, they actually all said that recruiting and training a replacement is time consuming. By the time that happens, the female employee comes back. And so they kind of most of them resort to distributing the workload amongst the existing team. Employers from 2 large firms stated that, you know, naturally upon returning from maternity, a new mother still takes extra leaves, you know, whether annual or sick leaves, to attend to her newborn's needs. And one solution they found to kind of allow for flexibility is, becoming more flexible. So rather than thinking about working hours, they think about deliverables. So, you know, if you can deliver this output by this, you know, by this day or date, you can come in later, take some leave earlier, and so on. So this shows that, you know, flexible working might be a solution to the challenges that come with maternity. Women were asked about, you know, based on their experiences, they were asked, why do a lot of women leave the labor market after maternity? And these are not new reasons. As you can see from the chart, we see that, you know, the lack of available nurseries or the prices of nurseries and the need for a child to be with his mother, you know, more or less cited reasons were the long working hours and the duration of the maternity. And interestingly, you know, 7.3% said that the husband or family refused to put the child in a nursery, and therefore a mother has to, make that choice to leave the labor market to be with the child. So as we know, in the private sector, there are 70 days of maternity leave in comparison to 90 days in the public sector. Employers were asked whether women can take unpaid leave after their maternity. And most of them said that they could, as long as it was unpaid. But 4 employers said that they couldn't, and some indicating that 7 days of maternity is more than enough and should be more than enough, and others stating that this should not even be an option and they should be taken from their annual or sick leaves. When asked about whether maternity can be extended to 90 days, some employers from different sectors said that, yeah, okay, it's the same thing. 20 more days is not going to be, make too much of a difference. But then the employers who are in line with this kind of thinking of not hiring and kind of wanting to avoid the whole maternity situation said that, they refused the idea completely. All right, so now looking at the Social Security reforms, we know that part of the reform was to kind of directly attempt to increase women's participation in the private sector by changing the maternity payment mechanism from the employer to the Social Security Corporation. As naturally as expected, 10 employers said that the Social Security reforms did not impact them positively, and on the contrary, now due to their higher financial obligations, because they have to pay a higher percentage on each employee, they are affected negatively. And those are mostly the ones who, from the beginning and from the start, do not hire women or choose not to hire married women. Overall, 8 employers stated that the reforms had a positive impact on employers, and it was mainly due to the introduction of maternity insurance and the way the payment is made, but also mentioned unemployment insurance and work injury. Only 2 employers stated that the amendments actually impacted their hiring practices positively and encouraged them to hire women, since they do not have to pay the maternity leave themselves, and it is covered by the SSC. The remaining also, some employers said that the amendments did not have an impact on them because from the beginning, originally they hire based on needs of the firms and the qualifications, and so this does not factor in their decision. Looking at women, we asked them about whether they are subscribed with the Social Security Corporation and what benefits have they received from it. We can see from the charts that around 44% of women are subscribed through work. A significantly less portion are subscribed voluntarily. Some were covered but stopped, and mainly due kind of to COVID-19. So this is the portion of women who actually lost employment during that period. And there's a portion who are not subscribed, and they're mostly the unemployed women who are not looking for work and who have not worked previously. 94% of those who are subscribed and work do seek counsel from the SSC when they face problems at work with their employers or legal problems and so on. So that's a kind of a positive indicator. So women were asked about how important Social Security was as a factor in their decision to work. And you can see from the charts that around 87 or 88% of women consider Social Security as an important condition when accepting a job. And 66.7% wouldn't accept a job in the private sector without Social Security. And then we asked them to kind of rate their insurances based on preference. So from top to, from most important to least important. And, it's interesting here to look to see that health insurance and maternity and unemployment are the top rated insurances. And then we have old age, disability, and death as the least kind of rated insurance. And I think this is natural, since a lot of individuals, a lot of employees think about short-term benefits rather than longer-term future benefits, such as pension, for example. One second. So we asked them, have you benefited from a maternity insurance and unemployment? We can see that a large proportion of women did benefit from maternity insurance, and then around 26-27% benefited from unemployment. In 2019, as you are aware, the Social Security Corporation allowed subscribers to kind of withdraw money from their unemployment fund for several reasons. We found that 49% of women actually did withdraw, and mostly to cover basic monthly necessities such as food, water, rent, and so on. And less so for children's education or medical expenses, or for savings, a very lower share for to save or to fund a personal project. So I'm aware of the time, moving to the last two slides. So, COVID-19 happened, it impacted private sector, its employees, and society in general. We asked employers how they were impacted. We found that, some firms were more disadvantaged than others, especially those who weren't considered essential during the full and partial lockdown. Firms who had employees living in different governorates, so and couldn't get them permits to kind of come to work. Those who could not do their work remotely from home, and those who relied on imports and exports, as we know that in the beginning, those were restricted. 3 firms, and we found this very interesting finding, that 3 firms were at an advantage during the lockdown because they had already introduced flexible working into their corporate culture, and therefore were able to work remotely during the lockdown, and it actually gave them that push to kind of go into that full transition of working remotely. Unfortunately, as a result of the economic impact of COVID-19, 7 firms that said that they will change their hiring practices, including reducing the number of staff in the coming months, removing part-time posts, which is unfortunate because we know that a lot of women kind of try to look for part-time work for flexibility to balance childcare and work, convert employee contracts from open to yearly contracts, and stopping new hiring altogether. As for the impact of COVID-19 on women, you can see from the charts that there is a percentage of women after the lockdown who have become unemployed, and they are in fact looking for work. And due to the crisis, a lot of them had to resort to spending their savings, 65%, borrowing from family, 45%, and borrowing from the bank around 9.7% of those. So this is kind of a very quick overview of our findings. Our papers, both research papers will hopefully be launched end of next month. And so you can kind of see or look at the results in more depth.
Thank you, Aida, and thank you, Jude. I think from a time point of view, we're 10 minutes behind schedule. So I will start immediately with the questions and answers. And I will start with the, I believe that Yasmin asked about the publication, and Jude already addressed the question that both studies will be posted once they are published on the website of the research center. So I will start from the last question because it is most relevant to the presentation that we've just concluded. And Noor asked on women's preferences for Social Security, and does the percentage vary according to educational level? So this goes back to the question of how important Social Security is, and would you accept a job in the private sector without Social Security? So over to you, Jude, to address this question.
This is actually a very interesting perspective to look at. Unfortunately, I don't have the numbers at hand to kind of give you that cross analysis, but it's definitely something that we can do. If you'd like to leave your email, I can send you a response to that.
So Noor, could you privately send your email address to Jude, and to make sure that the analysis, once done, is shared with you as well. So previously we got 2 questions on the presentation related to the double burden on women. So I will start with a question from Shada Sharif, and Shada was asking how access to additional help with households such as live-in nannies or housekeepers impact the situation. And I think here it means the burden on women, especially those working from home. So this question is for you, Aida, to address.
Sure.
And I have some insights on that once you're done.
Okay. I mean, in regards to the actual study, there were some who said, I mean, I don't have the exact number, but we can also pull that out in regards to having, live-in help at home. However, something like this, I mean, I think it would also be interesting to look at more qualitatively, because we also know that, there's another gender dynamic here, that oftentimes, the majority of households who do not have live-in help, or who perhaps cannot afford live-in help, also depend more on their daughters, to support them in the household responsibilities and childcare. And we actually have, a study that was done back in 2013, which shows this as well. So I'm sure it did impact the situation, but I think this issue or topic actually needs a whole other study on its own to be done qualitatively in order to capture all of those different variables. Shireen, you wanted to add something?
Yeah, and I lost the unmute button. Go ahead, Jude, and then I will comment.
Yeah, and if I just, just to confirm that, Aida, we did ask, if who in the household kind of helped the most with, and a very, very small percentage that they had, less than 1% had, a housekeeper or someone who can help in the home. And a lot of them did actually say that their daughters helped.
Thank you, Jude. And I would like to add on that that there is currently a study on the time that is spent on care responsibilities that is about to be also published, but that's more or closer to a time use. Rather than an in-depth analysis of the types and the experiences that women's have, and the findings indicate that women in Jordan spend as much time as a full-time job on direct care and direct and indirect care responsibilities at home, and that does not change based on their employment status, while men hardly contribute anything towards direct and indirect care responsibilities. And the only situations when women have less time on care responsibilities is when there is an elderly living with them. So apparently the elder person is helping with the responsibilities, or when there is help at home. But the message that the findings of that study and this study tell us that it is extremely difficult for women in Jordan to work because of this burden. The amount of the hours that they need to put between paid and unpaid work is huge. It's equivalent to 2 full-time jobs. And it's really important to discuss the dynamics within the households and to find ways to where this burden is more shared, and women are able to work inside the home and outside the home. So I'll go to the question of Kinana. And Kinana had a question on social norms during COVID. You didn't find that there were some changes to at least increased appreciation by men of women's workload and double burden, or even some men now helping with the household burdens? This is a question to you, Aida.
Sure. Unfortunately, we didn't ask a direct question in regards to appreciation. It was more of, do you feel, and that was, I think, the question that I showed, that, your spouse is doing enough, or, can be doing more, and so on. And I mean, for the most part, it was, I mean, I don't know if we want to go back to that chart, but it was, you know, men who said that no, their spouses didn't need to do more, whereas women who said that yes, their spouses did need to do more. So again, the gender perspective. Yes, I think it was the one before it, Jude. Um, yes. So wanted their spouses to do more. Um, you know, was by employed females, so much higher than, um, yeah, from the perspective of employed males. Um, in regards to, yeah, I mean, I think it is something that, again, perhaps may have been difficult to capture, you know, quantitatively. But even when we did, I mean, we did leave the opportunity for people to just, you know, comment anything open as they like. It never came up, um, you know, in regards to appreciation. And also, if you, I would think that if the appreciation was there, it would also have impacted that. So again, we didn't ask that question directly, but it is related to other things where it could have appeared.
Thank you very much, Aida. And we're hoping to finish within the coming 5 minutes. So I'll go to the next question from Zina or Zena on women's social security. So it's related to the presentation on social security. Did the study cover the early retired women in their 40s and how retirement salary impact their decision to get back to the workplace? Over to you, Jude, to answer this question.
Yeah, so there was a very small percentage of respondents who were retired. And there were a couple of questions about retirement preferences. So would you retire early? If yes, why and why not? And so on. So we can also pull these out. However, the percentage of retired women, to be honest, was you know, the smallest percentage amongst the respondents.
Thank you, Jude. Jude, there's also a question from Muhammad Shaheen on the transitioning into more and more temporary contracts and how the SSC or other government or the NGO institutions will address the lack of medical insurance for women in the aforementioned jobs, and how will it impact female employment overall? Muhammad, this is a very, very important question. Maybe we're not the right people to answer, but based on my read of what's happening and what I follow in relation to the labor market, I'm seeing changes in the flexible work regulations. It is getting improved, and the Defense Order number 6 even made it more flexible and more adaptable to the situation on the ground. And also the insurance bylaw of the Social Security now states that part-time workers will be, Social Security schemes will also be introduced to tackle part-time workers. So there is hope in the based on our readings of what's happening, and we hope that the findings of this study will inform the future work going on. I see a question from Dima. Jude, could you address Dima's question on the theoretical framework? I think it's related maybe to Aida's presentation.
Okay, but maybe Shireen, if I may add to your last point, that health insurance is an insurance in the Social Security law, but it is not activated. And it was interesting to see that women rated health insurance as one of the top, you know, insurances and benefits. And I think this is one of the recommendations that we will be giving to the Social Security Corporation in terms of health insurance for women.
Okay, so I think Dima's question is addressed to Aida. So Aida, can you see Dima's question? And she has a question related to the theoretical framework.
Sorry,
whether it is, yeah, it's on the chat. And
sorry,
basically,
go ahead,
Yeah, because I need to understand what feminist approach. Is it liberal or Marxism, or do we need to develop our own in order to enhance these results? Yeah.
Sure. So, I mean, a theoretical framework wasn't used for this specifically. When the question was, how has the COVID-19 lockdown in Jordan impacted gender roles in the household? And I mean, what we can say is that if anything, we used what we have previously looked at when we were looking at gender discrimination in Jordan in regards to a theoretical framework on patriarchy by Professor Saad Joseph. And we took elements from that focused on the social norms and the patriarchy of the self when designing these questions. But yes, we didn't use a specific approach. It was more of how is it in relation to patriarchy, social norms, and the overall question of women's participation in the public and private spheres.
Wonderful. Thank you very much, Aida and Jude. I would transfer this question to you from Faisal, because we didn't answer any of his questions. And he's saying, what is the problem statement? Would you like to rephrase that again for both research? I think I've provided an overview of the exact problem that we're facing, which is the inclusion of women in the labor market. But the two narrow topics have been presented by both presenters, and maybe Jude, you can shed light on that in a minute or less, please.
Yeah, so, okay. So here in the slide, we have the problem, the research questions and not the problem statements. We have that more in depth in the reports. The double burden, which Dr. Aida was just referring to, the problem statement is that, in times of before, so in the status quo, there is gender discrimination. In times of disaster, this gender discrimination increases because the responsibilities increase and women are not alleviated from their existing responsibilities. And as a result, after the resolution of the pandemic or the conflict or the disaster, we come to a point where the gender discrimination actually has increased against women, and the gender inequality has widened. So this is a statement, and it's actually kind of the theoretical framework that we used.
The double burden.
The double burden. So it was based on looking at previous pandemics, wars, like the Ebola pandemic, previous wars, and it is taken from several studies that kind of look at this cycle. As for the social security reforms,
Sorry,
the problem. Yeah.
Sorry to interrupt you. Could you go back to that slide maybe to show for Dima and for the others perhaps who missed that diagram of the cycle to show? Yes, thank you.
No problem. And for the social security, I mean, the problem statement is basically, as Shireen said, the few slides that Shireen was kind of given the context. Or explaining in the beginning of the presentation, looking at the persistent labor force participation among women, the barriers to their employment, and the kind of turning points in a woman's life cycle, including, education, marriage, childbearing and caring, and so on. And then kind of looking at reforms and the social security reform, and if and how that kind of impacted women's access and retention in the private sector.
Thank you, Jude. So before concluding, we only have a couple of points that are still not addressed, and I apologize for the delay, so we'll address them quickly. From Huda to everyone, Huda is making a remark. on the recognizing the unpaid work. We actually starting from that from that understanding that women's unpaid work is unfortunately unrecognized, and it is one of the active like one of our research is basically looking and considering how this unpaid work is affecting the household and is affecting women's employment in the private sector. And the recommendations will also be included in the final publication, Huda. So I would urge us all to go through the final documents. And the final question we have is from Noor, and she's asking if smaller firms measure turnover of men. So did we ask them if they are measuring turnover, Jude, during the study related to Social Security?
So they were asked about not specifically turnover, but asked about the number of employees that they have, how many men, how many women, so male, female, and the reasons why behind these numbers. And as I mentioned, those and specifically smaller, but also some medium and large firms who mention their preference to hiring men or unmarried women, you can see that reflected in the number of employees that they have. So they have a higher percentage of men, and some of these firms have zero women working in them, although there are sectors that could, and would have posts such as accounting, administration, logistics that can include females. So their argument about the type of work, and because the type of work is not suitable for women, it does not it contradicts with the type of work that they can be giving women.
Wonderful. Thank you very much, Jude. I believe that we addressed all of the remarks and the questions in the chat from the participants. Thank you very much for your participation. I take this opportunity also to thank Aida and Jude for the wonderful presentations, and we look forward for the publications to be out. And I'm sure that the recommendations will also be an important contribution, either directly or by informing the decisions that are being made now by government agencies on the different elements relevant to the employment of women in the private sector. Thank you, everyone, and I would like to conclude with that. Jude, do we have any last housekeeping messages?
No, just that the recording will be up on our YouTube channel again, and we will kind of send out the reports when they are launched, hopefully end of next month. So
thank you, everyone.
Thank you. And actually, also for those interested, a lot of these results are also available on our social media. So even before the report comes out, people can have a look at the results there in Arabic.
Wonderful.
Thank you.
Thank you, everyone, and enjoy the rest of your day.
You too. Bye.
Thank you.
Bye.
Bye.